in the state of Florida, that pedigree system worked really well for the distributors that bought directly from manufacturers and sold directly to dispensers. But it turned out companies that are, for lack of a better term, called secondary distributors, those that buy from other distributors and then sell into the supply chain, that system didn't work as well for them, and they were actually battling against us. So at the board level, we decided to change the criteria for membership and focused on saying that we represented primary healthcare distributors in this supply chain. These are the companies that we advocate for at the federal level, at the state level, and in the regulatory bodies. And as an organization, we develop a lot of other things, such as best practices or guidelines, and educate our members on how those can be used in the supply chain to achieve a more efficient and safer experience. We also do a lot of research to understand emerging markets and various trends. Within that business, we do a lot of work with our manufacturer trading partners because so much volume is exchanged between distributors and manufacturers. So we also have about 150, I think this morning it'll be 152 manufacturer members, and they join for two reasons really. One is the various networking opportunities with their primary business trading partners, but also the work we do around EDI, reverse logistics, barcoding, cold chain, and so on that helps bring some standardization to the industry around those business processes. We also have another 55 or so what we call service provider members, and these are companies that provide technology, logistics, and consulting services to either those distributors or manufacturers. So that whole realm of HDMA is around distributors, manufacturers, and those service providers. This is a rapidly changing industry, and it's not the least of which is the regulation that we face. Obviously, the Drug Supply Chain Security Act is a huge part of what we're trying to do and will keep us focused and busy for the next 8 years as we try to complete the, or I guess 8.5 now, as we try to complete the implementation of this process. But we're also looking at an industry that's consolidating rapidly. You saw news recently about Pfizer being interested in GSK. Endo Pharmaceuticals is going to buy PAR. We've seen Cardinal Health buy Metro Medical. We've seen the consolidation of Walgreens with an international partner in Alliance Boots and coordinating that with AmerisourceBergen. And we see a lot happening on the international basis. And as all this happens, we sort of feel like our members are fairly well positioned to succeed in what is a rapidly changing business. The best way to define our members, I don't know how much you know about our distributors, but roughly 90% of everything that ends up going into a pharmacy, into a dispenser, is handled by HDMA member companies. So in a $360 billion industry, over $300 billion is handled by our guys. You see in the relationships between our largest members and our largest chain customers, the chains are actually getting out of self-distribution and turning over that service to our distributor members. So that 90% number is actually one that's increased some over the last 4 or 5 years. So the volumes that are moving are actually pretty huge. And when you think about something like the Drug Supply Chain Security Act and how we have to handle those volumes of transactions, which today happen at the lot level and in the future will happen at a serialized item level, there's a lot of complexity and a lot of technology that has to be applied to these solutions. So on a business front, there's a lot going on with HDMA and its members, and this extends out into a lot of other issues. But the focus really has been on getting this law passed, which happened in 2013, November of 2013, and now the process of implementing and ensuring that our members are able to communicate directly with their manufacturers and also with their customers. So to talk a little bit more about what we actually do with our members and the law itself, I'm going to turn it over to John.
Thanks, Perry. So like Perry mentioned, in November of 2013, the Drug Quality and Security Act was signed, and that had two main components to it. One was drug compounding, and the part that we're working on is the Drug Supply Chain Security Act, or DSCSA as we refer to it. And what this did was this brought together a national law to regulate traceability of these products, which preempted 50 states from doing their own different traceability activity. So this was something we felt was important and valuable to our membership. So here's a timeline of the law. It's a 10-year implementation law that had its first critical deadline of January 1st of this year, where manufacturers had to send and distributors had to receive transaction information, transaction history, and a transaction statement. And that included information such as product name, strength, NDC, transaction date, address of the buyer and the seller, et cetera. There's and many more characteristics as well. So that being a huge undertaking, the FDA granted the industry enforcement discretion until May 1. So that just passed from January 1 to May 1. You know, our members and manufacturers were working out any technical or logistical issues they had in receiving and sending that information. And from our understanding, they've been very successful in accomplishing this. So the next critical deadline is July 1, where dispensers are required to receive that TI, TH, and TS at the dispenser level. Going forward, what's critical and important, I think, for your interest, is that in 2017, manufacturers will be serializing product. In 2018, repackagers are required to serialize product. In 2019, distributor traceability goes into effect, which they must buy and sell only serialized products, and they have to verify returns through that serialized product. And then full unit level traceability will be in place in 2023. So each product, each package and homogeneous case of RX product is required to have a product identifier, which is a standardized numerical identifier, or an SNI, a lot number, and expiration date. And the SNI is a combination of the NDC number and a unique alphanumeric serial number up to 20 characters. And this is a sample of what that might look like. Each package must have a 2D barcode, and a case must have a 2D barcode or a linear barcode. And the product identifier must be in both human and machine readable form. So what HDMA has done to help our members in the supply chain get through this and achieve this accomplishment, we have put together a number of resources that are valuable for them. We created a set of transaction scenarios, which is our interpretation of the law of what information is supposed to be passed by what party during the different transactions that take place. We have an EDI ASN 856 guideline, a barcode guideline, a barcode quick start guideline, which focuses on the law. So the barcode guideline is a sort of our master document of barcode information. It's sort of for the novice. If you need to learn about barcodes, you can start with that. But then if you're a user of barcodes, you can go to the quick start guide and see how to apply it for DSCSA. We have a new product form that manufacturers use when introducing new RX products. And we wrote an ASN exceptions guideline for exceptions that the supply chain may face when doing their EDI transactions. We also have a number of events that we host that talk about supply chain and distribution. We have our Distribution Management Conference, which is typically held in March. Traceability Seminar, which will be in October of this year. We have our International Pharmaceutical Distribution Conference, which will be in Brussels in November. And we have a number of webinars which we've put together sort of on an as-needed basis, hitting a critical topic that's relevant. We record those and make those available on our web page. And we've done a number of those here recently that are available for your review or download if you'd like. So all that information can be found at our website, and we do have a Twitter feed if you're interested in following along, see what's going on in the distribution supply chain.
One thing I'd add is we kept this at a fairly high level because there is a lot of information out there, but we wanted to make you aware of the deadlines and sort of the key elements, particularly of the of what we'll eventually have to do with automatic identification. But we can go into a ton more depth if you like. If you have any questions, we'd be happy to answer any of those right now.
Hi, this is Artie. I'm actually trying to absorb some of the information that you've given, and it is at a fairly high level. As you may know, we, with the medical device industry, are dealing with a concept called UDI, where there is unique identifiers assigned to the product level, and that information is communicated to an FDA website in the cloud euphemistically called the Good ID. How would you compare that to what the pharmaceutical companies are having to do, and what are they communicating today, and to whom are they communicating it? Is it a centralized database, or are they communicating to each other, and is GS1 involved? And there was about half a dozen questions in there.
Yeah, so that was so we're in what sort of I think we call sort of a one-up, one-back model. What's getting communicated today is lot number information about the products being shipped. So when a manufacturer sends something to a distributor, they're sending information about that transaction in an advanced ship notice that includes sort of the roster of products and associated lot numbers that are included in that shipment. And the distributors are required to receive that and actually hold on to that for 6 years. So the key elements of information are the lot number. The key vehicle right now is the advanced ship notice. Right now, distributors are not required to send that onto the distributor or onto the pharmacy, but they'll be required to do that on July 1. The fascinating part about that is we're not sure that all the pharmacies really fully understand what they have to do, because they have to be able to receive it and also hold it for up to 6 years for review by FDA. There is no centralized database at this time, and there's really no sort of plan for one. So that's, I think, one key difference with the UDI model. We'll be transitioning over a period of time to item-level serialization, so each bottle in a case will have its own serial number that'll include the information that John mentioned. And we're going to have to find some more effective and robust ways to share that, because I think we're going to start making the ASNs a little outdated, or at least a little troubled in terms of handing that information. A lot of companies are looking at EPCIS as a potential. So you won't have a centralized database, but I think you'll have a lot of potentially cloud-based solutions that kind of talk to one another on a regular basis with access by the people in the supply chain who are related to that transaction. FDA then has the authority, if they suspect something, to come in and request information about those transactions, and companies have 24 hours, right? 24 hours in which to respond to an FDA request. There's some side notes to all that, which is, if there's some things that companies have to do if they suspect product for any reason is not appropriate product, they're required to report it up to who they got it from, and also to the FDA. There's some triggers on that, but that's about it. Right? So. Did that answer all 12 of your questions?
It answered several. Just a word of caution. I didn't get permission earlier, but about 30 seconds into your presentation, I decided this is going to be one heck of a presentation and I should record it. If anybody's uncomfortable with that, I'm happy to delete the recording, but be warned that it is being recorded at this point. I have a few more questions, but I think I'll defer to the folks on the phone if there are any other questions out there that folks want to ask.
I do have one question. If you don't mind, this is Dave from TechLinks. Regarding the serialization information, basically the slide that you had earlier showed in like number. Is that SNI number issued to them? Do they have to contact some sort of issuing agency like GS1 or something like that to get an SNI, or is it just a arbitrary number that they assign themselves?
So John can back me up on this. The whole number is based on the NDC. The NDC is assigned by the FDA when they get the product. So they get a company and product identifier, and then they can add the specifics of the package code, and then the serial number is self-generated by the manufacturer and the packager. And yes, GS1 is really very involved in this. They've been involved with sort of all the legislative and regulatory pieces explaining how their numbering system and barcode guidelines and such can support, and EPCIS can support the elements of implementing DSCSA. So, but it's all made to fit into that. G10. It's all the NDC. The way we structure the NDC is built to fit into a G10 structure.
Okay, thank you.
This is George Wright. I think another way to put it, and Chuck, maybe you'll confirm this. The SNI is an SG10. It's a serialized G10 in the pharma world.
Yeah, that's right, George.
Okay, that makes total sense. Thank you. That clears it up a bit.
Now, wasn't the California rule at least specifying that the serial numbers, even down to the lowest unit of sale, had to be randomly generated and then aggregated up to the next level of packaging? So I thought that the serial numbers would be totally random in that case.
It wasn't specified in the law that had to take place. So the industry is having that discussion right now of what's the best way to handle this for the products to move through the supply chain as fast as they have to. So there's concern that if the wholesale distributors have to scan every saleable product upon receipt, that would slow down the supply chain to a point that there would be drug shortages or there would be concerns. So aggregation and inference are topics that are under discussion right now.
Okay, so they backed off the California requirements. That softened them somewhat.
They softened them somewhat, and they're going to let the industry figure that one out.
Okay. Any other questions out there?
Yeah, hi, this is Dave Coons. I have a question. I think you mentioned that in July the actual pharmacies will need to be ready to accept the lot information. I'm curious, does that pertain to, say in the case of a retail pharmacy chain, does that pertain to the individual retail outlets or to the distribution center for that chain? Like how far down does it go and when?
So it goes to the receiver level. So right now what's happening is, like I said, a lot of the self-distributed chains have actually started kicking over distribution to the distributors. So the information has to be received about the distributor has to send information that pertains to that store that's receiving. So how they're managing that with the chains, there may be some corporate methodology for that. We're not sure. With the independent pharmacies and smaller clinics and so on, there's a provision in the law that allows dispensers to contract with a third party to maintain their data. So what we'll probably see is a lot of the distributors creating portals or other types of solutions for those independent pharmacies that the pharmacies will be able to check the data that's stored there, but it'll be kind of maintained and presented by the distributor or some other partner.
Okay.
From a chain of custody perspective, I see capturing the departure of the product from the manufacturer. I see its receipt at the distributor location, and then eventually receipt to the pharmacy or pharmacy chain. But what if it goes through several depots along the way, and if there are stop points and repackaging, not repackaging, but moving from one truck to the other, are there any provisions for capturing that kind of activity?
So no, not in a sense. So most, for instance, distributors, they'll have a line haul shipment to a depot where it's broken down for the smaller trucks to deliver to individual pharmacies. So that sort of 3PL activity or shipping activity is not captured in the transactions because it's operated on behalf of the shipper. Where it does occur is everything's related to the financial transaction. So, if a manufacturer, for instance, uses a common carrier to ship to a distributor, the carrier is excluded from having to maintain any of that information or add to it. If the distributor receives it and then sends it to another distributor in a financial transaction, so someone buys it from them, they have to send elements of the transaction information and the transaction statement to that second distributor. The second distributor then has to collect that information for all the products that they've received and send it on to whoever they have to ship it to. So it really, and there's a couple, like in 340B programs, this is kind of in the weeds, but it's interesting because the hospital tends to be the financial owner of the product in a 340B program, but they contract with a specialty or a pharmacy of some kind to actually fill the prescriptions. The product goes to the pharmacy, but the financial transactions with the hospital. And so the information actually follows the financial ownership of that. So there's some little elements of that we're trying to work out, but try to think of the transactional flow rather than the physical product flow. Most of the time it's tied together.
Great answer. Thank you. Any other questions out there?
I'll add to that last comment. John showed you, actually go back to the list of stuff. So, no, actually, for the toolbox. There. So if you see the one right in the middle on top above the toolkit, it's called the transaction scenarios. We went through 18,
something like that,
like 18 or 20 different transaction scenarios, and in each scenario for each transaction, we apply. Now this is HDMA's view of it. Some people may view differently, but this is our view of it. We applied what our assessment of the law was and what was required in each of those transactions. So, the simplest one is manufacturer selling to a distributor selling to a retailer. And then we get more complex. What if a manufacturer drop ships to the retailer on behalf of the distributor? What if the distributor drop ships to a retailer on behalf of another distributor? What if there's a repackager involved? Every one of those types of transactions, for each exchange of ownership, we define what information we believe should be exchanged in each one of those transactions. So that's a good tool, and a number of these tools, as John said, are on our website. They're free, simply because it's so important for our members to have all of their trading partners kind of working off the same sheet of music.
Great. Another question from Artie. We're obviously an AIDC-centric organization. Can you talk a little bit about conversations that may be going on around linear barcodes versus data matrix, two-dimensional barcodes, and RFID? Is that something that's being discussed, or is the assumption that it's mostly just barcodes and potentially just expand on that if you can, please?
Well, so if you go back, if you go back eight years, I guess, 8 or so years, really when we were trying to, as an industry, come up with a solution to this without the full-blown impetus of a law, we had a lot of conversations around RFID. And while we didn't end up in a place where we could fully define what the system was and get out in front of these laws, I think the one thing we kind of finally seeded was that from a manufacturing standpoint, from a security standpoint, from a cost standpoint, we weren't going to be able to get to RFID. So I'm going to ask John to pop in here a little bit, but we did get to data matrix. We get to a two-dimensional barcode for that serialization. But as we roll up to case and higher levels of packaging, linear barcode is still critical, and where that label is placed on the box is still critical because of how we use them in our highly automated distribution facilities. So there had been a lot of conversation about that. I think I see a future where we kind of transition to this. I don't think there's a requirement specifically for the barcode, but it's kind of such as 2D barcodes. So that's where we're focused right now, is using that for the serialization.
Yeah, that's correct, Perry. There's been a lot of discussion about where do you put the barcode, what's the 2D barcode, the data matrix barcode, the size of it, the ability to read it, verifying or qualifying the readers to make sure that they can read it. The manufacturers and distributors routinely share this information so that they can confirm that their systems will read the barcodes that they provide them. They are moving towards the 2D barcodes where applicable, and they're using our guideline for size and position of those labels to help at the case level and at the package level where necessary. RFID has not been something we've discussed recently. Like Perry said, it was looked at several years ago, and for various reasons was not the choice that they're moving forward with.
Did I hear earlier that on larger containers there was a preference for the linear barcode?
There's an option. So if you're at the case level, you can have a 2D barcode or a linear barcode.
Okay, but for readability or for long distance scanning, because a lot of these things are up on pallets and on tracks and things like that, there is no preference for linear versus data matrix.
That's correct.
Okay, great. Thank you. All right. Any other questions?
I'd like to know how I can get this traceability toolkit.
So that's available on our website. What I can do is send Mary Lou a link or several links to get you to the documents that will be valuable to you.
Great, thank you.
And this is Mary Lou, and I actually have a couple questions myself. From your organization's standpoint, what input or what involvement did you all have as an organization and your members in the development of the Drug Supply Chain Security Act?
Well, there's a lot of people that tell you that our government affairs team wrote it. So we've been involved in this from the very beginning. That started in Florida. it kind of evolved to California, and ultimately we kind of saw this environment where the last thing we wanted was 50 different state laws, because every state was starting to look at this in a slightly different way. When we found this compounding bill, we knew that there was an opportunity to link DSCSA or to link our part of it to that Drug Quality Security Act. Our team, which was headed up by Liz Gallinot, who's our Senior Vice President of Government Affairs and inside legal counsel, she worked closely with the appropriate staffers on the Hill to make this happen. We also worked very closely with Pharma, GPHA, Bio, NACDS, NCPA to make sure, and those are the organizations for branded and generic pharmaceuticals, chain drug, independent pharmacy, and some others, to make sure that that something was getting written down that was palatable to the entire supply chain. So while it's not perfect, certainly for any one segment of the supply chain, for the group as a whole, I think there's something that we can actually all work with.
Now, with the Drug Supply Chain Security Act, this is definitely a U.S. Responsibility. Are you in conversations with other countries? For example, we had referenced the FDA UDI rule. We also work with the DoD with their UID rule, and we're seeing an impact globally. Other governments are following suit, or the U.S. government is starting to partner with other, for example, European governments, because we're looking to make it global. A membership is global, and we would rather see a standard be globally focused versus country focused, because in the end it really doesn't help the consumer. It can mess up the supply chain and so forth. Are you seeing or starting to see any type of involvement in, I guess, globalizing this act?
Yeah, you know what? I'd argue that we're kind of on the road to that, but it's a really long road. There are other countries that are implementing traceability or verification systems, and I say it because fundamentally, from a technology standpoint, certainly from an auto ID standpoint, they're all kind of using the same foundation in terms of, a serialized item level kind of look at things. But different countries are implementing these things for different reasons. So in the United States, it's more about, it's in the name of the bill, right? It's supply chain security. It's about preventing counterfeit and diverted drugs from entering the supply chain and injuring patients. Now, the interesting thing, and where we got caught up in a lot of discussion, is that the U.S. probably has the lowest incidence of counterfeit drug in the supply chain of any country in the world. And so some people had a really hard time getting over the idea of why do we put all this cost into a system that isn't really that plagued with security issues. But at the same time, all it takes is one. And that's what we had to get our heads around. In Europe, they're implementing a system that's essentially a verification system. The manufacturer places a barcode on the product. The distributor is required to verify that product only if they have a reason to suspect that there's a problem with that product. And then the pharmacy is required to verify at the point of sale that that product is in fact something that the manufacturer serialized and put into the database in the sky. I think Brazil has a different system. Turkey has a different system. China is kind enough to create their own system without actually using any global standards. So there's a couple different systems out there, but people use it for reimbursement fraud as much as they use it for supply chain security. So my point is there's a lot of things going on out there. As the distribution and retail parts of the business become more global in nature, and that's just now starting in the last year and a half, and they start working with manufacturers who are already global companies, the conversation about how we sync all these things up is eventually going to happen. And on some level, they already are. but I think that's an 8 to 10 year kind of down the road sort of conversation.
Barry, let me just add to that. The laws that have been written in the different countries are fundamentally different in many cases, but the standards that are being used for barcodes, for example, GS1, are global international standards that are being applied. So there is some standardization, but the laws themselves are different.
This is Mary Lou again, and this question is not only for HDMA, but it's also for the folks on the call who are AIM members as well. After hearing about HDMA and this Drug Security Act, and gentlemen at HDMA, I believe you're familiar with AIMS and AIMS membership and what we're involved. What are some areas that we can collaborate? What's something HDMA can bring to AIM members and vice versa? How can we be a resource to each other?
Well, that's a good question. I think as we're sort of moving forward in this implementation process, particularly from a law standpoint, it was less about the technology and more about sort of the business process capabilities of what our members really needed to be able to do. So all the conversations that we had internally were primarily with our distributor members, and then once we sort of had a consensus among those guys, we'd get out and work with the other parts of the supply chain. We're in this implementation phase now, and there's a lot of things that are going to go into that. One is FDA. The law actually requires pilots to be done by FDA that kind of support understanding how traceability at item level is really going to work. We're starting that process now, and while we'll be working primarily with our distributors and manufacturers, I know that they're going to be involved with their vendors to make sure that the technology actually meets their needs. So there'll be a lot of work done directly with those companies. So I'd have to think about that a little bit more, and I can't sit here and tell you that I have a pat answer. It'd be very easy for me to tell you, that we have a couple of toolkits and a couple of events that some of your members may be really interested in participating in. But your question was more specific than that, and I don't think we've crossed that bridge yet. But I'd be open to suggestions.
Clive, I know you're on the line. I hate to put you on the spot, but you're kind of our resident guru. In my mind, you're my resident guru in this area. What are some things that come to mind for you?
Clive, you're muted if you're talking. So, Mary Lou, let me take a stab at this.
Go ahead.
Clive, are you back?
Yeah, I'm sorry, I was on mute. I was trying to be polite and was a little too polite. I've worked with the FDA on this since the early O's, and the assumption everybody's making is that all 2D barcodes are going to be data matrix. Is that a valid assumption, or are you finding any pressure from some people to use other barcodes like QR code or PDF 417?
No, at this point, we're not feeling that pressure. I believe their focus is on the data matrix barcode, definitely, because of the standard and the information that it can provide in the format that GS1 recommends. I think that's the direction we're headed.
Good.
Yeah, Clive?
Yeah.
Yeah, this is Chuck. I can add that. I can tell you that from the GS1 global standpoint, the only 2D symbology that we're actively promoting is the data matrix-based GS1 data matrix. So when it comes to 2D, we're going really promoting only one 2D carrier. And that's actually been at the wish and direction of our members, because they said they don't want to get into the complication of others. They realize others are technically capable, but they want to be able to focus on one. And so data matrix is the direction that we're going.
Yeah, some time ago, George Wright and I wrote a series of letters in response to the FDA on behalf of AIM, recommending that the data matrix be the barcode used on both devices and drugs. Part of it's because all of it comes together at the patient bedside. And I completely support what GS1 is doing, Chuck.
Thanks.
Great. Mary Lou, I want to take a stab at talking about the partnership possibilities a little bit. Our company, Innovatum, and I'm sure TechLinks and George and Clive and lots of other people are involved in implementing systems now. And I am working with 3 different very large pharmaceutical companies right now who are implementing serialization. And we're constantly dealing with barcode questions and label quality questions and so on. And it's our role in life. The FDA comes to AIM for assistance on these matters. And I'm sure that we would be very happy to work hand in hand with HDMA to provide same kinds of assistance to their members should it become necessary. So I think that's certainly one area that we can assist and cooperate with the folks.
Yeah, I think that's a good point. We do have our barcode guideline, and our members are referencing that regularly.
Yeah, I constantly hear it. This is not in compliance with HDMA. Well, yes, it is with the old guidelines, but not the new guidelines. So it's a reference Bible out there in the pharmaceutical environment, and I see it all the time.
That's good to hear.
Excellent. I think unless there's some urgent things, first thing I'm going to do is stop the recording, which I'm about to.